Hi everyone. So today we will try to understand a condition which is called as fissure in ano. So a lot of times patients come to me saying that they suffer from piles, because for the common public, anything that causes bleeding or that causes pain at the anal region is considered to be piles. But believe it or not, 50% of the patients who come saying that they have piles actually have something called as a fissure. So today we will try to understand what is fissure, and what is the difference between fissure and piles, and what is the treatment of fissure. So fissure is nothing but it is a crack that happens at the anal region. You can also say it as a wound that happens at an anal region. It is an extremely painful condition. People who suffer from fissure say that they have never ever experienced such kind of pain in their lifetime. The pain is most when the person is passing motions. It also results in some minute quantity of bleeding along with the motions. So when a person or a patient comes to me or a doctor saying that he has pain while passing motions and there is some kind of bleeding happening, and also often they have hard stools, so the diagnosis is pretty much made on history itself and it is confirmed by examination. So this is how we differentiate fissure from piles, because a person who suffers from piles generally comes to the doctor saying that he can feel some swellings that have appeared near the anal region, and of course he notices pain while passing motion. The characteristic difference is most of the bleeding that happens from piles is painless, whereas bleeding that happens due to fissure is painful, very painful. So this is a very characteristic feature of fissure which easily gets itself differentiated from piles. Now we'll try to understand why the fissure happens in the first place. So let us try to understand the pathogenesis of fissure. The most common cause of occurrence of fissure is hard stools, constipation, and unnecessary straining while passing motions. This then leads to a crack at the anal region, which is called as a fissure. As I told, the fissure is an extremely painful condition and it causes tremendous amount of pain to the patient while he is passing motions. This in turn will result in a condition called as spasm. So there will be spasm of the anal sphincter. This is an involuntary spasm that occurs because the brain now sends signals to the anal sphincter. Anal sphincter is nothing but the muscle that is present at the anal region, which has to relax whenever you want to pass motion. But since now there is tremendous amount of pain, the brain sends signal to the internal anal sphincter to contract, because if it relaxes there will be passage of gas or motion and this is going to cause pain. So in order to protect the person from pain, the brain will send signals to the sphincter to contract, and this results in spasm. Now when there is a spasm, imagine if the motions is now coming to the anal verge and it has to be evacuated, but the anal muscle refuses to relax and goes into a spasm. This in turn comes back to our primary problem, that is again constipation. The patient has to put unnecessary extra pressure while passing motions, and most often these are hard stools, and the cycle continues because this now deepens the fissure again, resulting in pain, which again results in spasm, and the cycle just goes on and on and on. So once we have understood how fissure happens, next we go to how can we treat fissure. So the good news is that most of the fissures can be treated medically, that is with medicines, and very few of them will end up with surgery. So when we think about medical treatment for fissure, it mainly is directed towards softening your stools, because as we saw in the previous discussion that fissure actually happens when there are hard stools or a person puts undue pressure while passing motion, and that results in tear that happens at the anal region. So the treatment of fissure is mainly by giving laxatives which will soften the stool, and hence the pain is less and bleeding is less while passing motion. The second most important thing is the sitz bath. So I'll try to diagrammatically explain to you what is a sitz bath. So sitz bath involves sitting in a white bucket or a tub. It has to be filled with warm water, and you have to sit inside in such a way that the anal verge is underwater. There is no need to add any salt, Dettol or betadine. This has to be done for about 15 to 20 minutes, and try to do it for at least 3 to 4 times a day. So after sitz bath, the next form of treatment is to use a local anesthetic ointment that will soothe the area and reduce the pain that the person experiences while passing the motion. So most of the times when the medical treatment is done rigorously, healing of the fissure takes place. So it generally takes about 2 to 3 weeks for the fissure to heal, and the patient recovers. But, and there is always a but, fissures are known to recur again and again. By that I mean is that a person can have fissures repeatedly again in the future, even if he has recovered completely from the first episode. This is the reason for this is generally hard stools and putting undue pressure while passing motion, which results in fissure. And a person is known to be habitually doing this, and only those people end up with having fissure. So a medical treatment of fissure does not guarantee that the fissure won't happen in future, and more often than not it happens. So that is where the surgical treatment for fissure comes into play. So the more interesting surgical treatment of fissure I will discuss in the next video. Thank you. Sid's bath involves sitting in a wide bucket or tub as shown in the figure. It should be filled with warm water and you should sit in it for at least 15 to 20 minutes in such a way that the anal verge is under water. I often get asked if you have to add salt, Dettol, betadine to the water. I would suggest plain water is sufficient.